Such a pleasure to be here in Guernsey, listening to all these amazingly disruptive speakers about envisaging Guernsey as the best place to live in the world. And I would say, in order for Guernsey to be the best place in the world, it has to be the healthiest place in the world. Now, I'm going to make some pretty radical suggestions about how we're going to get there today. And it's going to include drinking wine, getting dirty, and meeting new people. So I just want to prepare you for that ahead of time. You know, one of the reasons why you're in such a great position here in Guernsey is you don't have to ask anyone for permission. We're not asking Brussels for permission. We're not asking London for permission. We just have to do. For the last 10 years, I've been in the trenches of health creation in America. I've met thousands of doctors, and I've had the opportunity to interview everyone from Fortune 500 CEOs to internationally respected gurus. And one of the biggest problems that one of the biggest frustrations that people share consistently is that medicine is evolving too slowly to overcome the chronic diseases that are now epidemic in America and all over the industrialized world, and Guernsey is that's what's driving all of these costs that Mark just mentioned, is these chronic diseases. You know, 5 years ago, I was angry. I wanted to rebel. I wanted to get in touch with my representative, and I wanted to, I wasn't sure exactly what to do about it, but I read this quote, and this quote has been so powerful over the last 5 years, and it's really driven my intention of what I've been looking to do for the last 5 years. And that quote is by Richard Buckminster Fuller, and he says, "You never change anything by fighting the existing reality. To change something, build a new model that makes the existing model obsolete." So what is this new model? Community, and not medicine, creates health. The first place that we see that community and not medicine creates health is the blue zones. These are areas in different parts of the world where people live consistently to 100 years old with much lower incidence of chronic disease. From Okinawa, Japan, to Sardinia in Italy, to Nicoya in Costa Rica. Now, all of these areas have certain things in common, but by far the most powerful and exciting is community. In all of these areas, these groups work together and support each other as part of the tribes. They eat together, they cook together, they play together, and they pray together. Now, you might say, James, there are a lot of other things that happen in blue zones. It's not just community. You know, the Okinawans are eating tons of fermented soy, and the Seventh-day Adventists in Loma Linda don't eat one day a week. What is it about community that you think is so powerful? In his book, Malcolm Gladwell, in Outliers, he talked about this really interesting community called in Rosetta, Pennsylvania. And in Rosetta, Pennsylvania, it was discovered in the 1950s as a small community that had remarkably less chronic disease than the towns and cities around it. And what they found was this was a group of Italian Americans that had come from Italy to Pennsylvania and had maintained the same social and community structure. And there were some changes. There were certain changes that were different from their life in Italy. They had a lot more animal fat, animal protein. They also smoked and drank as much as the other towns around them in America. But the outcomes remained the same. In fact, they had lower levels of heart disease in the 1950s, when heart disease was absolutely epidemic in America. And so the strongest thing that they had going for them was community. But yet they had significant changes in the food since then. And so the other thing that was so important to them was community. Now, in the next generation, when the kids Americanized, when they left this social structure, they were left like just every other American town, fat, sick, and nearly dead, as the saying goes. So what the blue zones and what Rosetta, Pennsylvania show us is that it's community, not medicine, that creates health. Now, another area where we can see that community and not medicine creates health is with regard to the microbes that live on, in, and around us all of the time. Germs. It's quite an onomatopoeic word, isn't it, germs, when you say it. But we can talk about microbes if you prefer. But the new science on microbes is absolutely astounding. You know, if you think about the 20th century, it was all about our interaction with germs. It's all about the human race dominating germs. And through a combination of sanitation, nutrition, and antibiotics, we conquered the germs that live on, in, and around us. But there's a natural limit to this, so much so that the deputy director of the CDC recently said, we have reached the end of antibiotics, period. So, in 2011 was a remarkable study called the Human Microbiome Project. And in that study, it should have really shook the foundations. When I said earlier, that the speed of evolutionary change is too slow, they say that it takes 17 years for new information to make it into everyday clinical practice. 17 years, even today. And the human microbiome showed that more than 99% of all of the germs that live on, in, and around us were mutually beneficial, aiding our digestion, immunity, and metabolism. And we needed them, and they needed us. And since then, in the last 4 years, there's been a wealth of science to show that germs, particularly in our gut, affect the health outcomes from our brain to our joints. Furthermore, by killing off these germs, particularly in our gut, we're actually driving chronic disease. All the inflammatory diseases, autoimmune disease, the epidemics of allergies were all being driven by killing all of these microbes, particularly in our gut. There is an emerging field in medicine, a niche in medicine, or niche. I've started saying niche since I moved to America. But it's called functional medicine, and it respects the inner ecology of the body, the relationship between us and our germs. And functional medicine, for years, the prevailing paradigm has been to identify symptoms and to use drugs to suppress those symptoms. But in functional medicine, it turns everything on its head, and it uses symptoms as a way to be able to understand what's going on and the root cause of dysfunction, and then be able to remove that root cause and allow the body to heal. Now, functional medicine, it has an ecological system, and just last year, this functional medicine showed that it was ready for prime time, with the Cleveland Clinic, one of the most respected and innovative health organizations in the world, building a new functional medicine center and betting on it for the future of chronic disease management. So again, we see that it's a community of microbes and not medicine that creates health. I just want to talk a minute about the use of community in medicine. Does the medical system right now take any advantage or maximum advantage of community? Not really. The majority of your interactions with a doctor are one-on-one. So the question we have to ask ourselves are there examples of community being used successfully in medicine, starting from scratch? And the answer is a resounding yes. We are now standing at the intersection of community and medicine. There was an amazing project in America called the Daniel Plan, and leading functional medicine doctors came together with the Saddleback Church to create the Daniel Plan. And 15,000 of the people that go to the church lost a combined 250,000 pounds and enjoyed extremely positive health outcomes by working together in small groups to empower behavior change. Furthermore, some of the most exciting results that we're seeing in functional medicine are in a non-traditional style. In the old system, one doctor would just go room to room to room, seeing patients individually. In group visits, 2 providers see patients in groups. There's so much power and value in people working together with a group of your peers in terms of empowerment and vulnerability and support. Now, This is all what's happening now. But the most exciting thing, and what can really scale this up, is technology. Technology is coming along and empowering communication in a new and exciting ways. And one of the biggest beneficiaries of that is communication, seamless communication. I have a friend who lives in Iceland, and even though we're not together physically, he is challenging me every day with the number of steps that he runs, steps that he walks, or the miles that he runs, to be able to challenge me with his fitness tracker. And I'm not the only person that he does this with. He has a whole community of people all around the world that egg each other on to be healthier through technology. We've also had the opportunity to work with lots of medical clinics that create online forums and discussion meetings where patients are able to communicate with other patients and provide peer-to-peer support. Just imagine how much value and how much knowledge a mother accumulates having a child on the autism spectrum over 10 years of looking after that child. And then imagine how much value is created when they can communicate what they've learned over a period of time to other parents in the community who may be completely overwhelmed with an autism diagnosis. This is all free, empowered by technology, and completely scalable. Now, what about doctors? For the last 100 years, a combination of reductionist science and industry have driven doctors' behavior and told them what to do. So much so that it's almost a joke in America now how pharmaceutical reps come and tell the doctor what to do with each of their patients. But I've been to Silicon Valley, and I've seen the future. And it's democratization. It's doctors working together in real time, giving feedback and best practices between them and the groups, and contributing to a hive mind, aggregating best practices. So you can see that it's community and not medicine that creates health. So what can we do right now, all of us in this room, to start this process of building community in Guernsey and developing the healthiest place to live in the world? How can we make Guernsey the 6th blue zone by 2020? Well, the beauty of the functional medicine operating system is that it's participatory. The future of medicine isn't going to be something that's done to you and you're just a passive patient taking what the doctor gives you. You're an active participant in your health. So right now, you don't have to ask anyone's permission to eat more plants, to think differently about your stress, and to move regularly. You also don't need to ask anyone's permission to be able to improve your internal microbiome. You can take a probiotic, you can get into nature, you can get a pet. One of the best things, the emerging science that's coming out right now, citizen science projects, is showing the best way to improve your internal microbiome is to get your hands in the dirt, start planting a garden. Topsoil is one of the most precious resources that we have, and I think getting our hands in the dirt and coming to connection with that is something that we can all do for free right now. And what about doctors? You can start to take advantage of this community and do things like group visits to be able to start to take benefit of the peer-to-peer communication and peer-to-peer support that's available through that type of model. Get together groups of doctors to learn about functional medicine. Learning is easier in community too. It's community, not medicine, that creates health. Now, what is the most evidence-based thing that you could all do today to start this process of developing community and creating better health outcomes? Dan Buettner, who is the person responsible for the Blue Zone research, they've been trying to create blue zones already for the last 5 years since they worked it out. How can we create blue zones? And what they've found is the most evidence-based strategy, the most effective strategy for anyone to start in a community like this, is to take people who are ready to change and introduce them to each other, to form new communities. Now, I would bet that the kind of people that come to a TEDx event like this are those people within a community that are ready for change. So what I'm going to recommend today is you're going to start the process of just look around. Meet 5 people in this room today. Share a couple of glasses of wine this evening, just like the Sardinians do in their blue zone every day. and feel the power of new community. One of my favorite quotes that really embodies what I think is the strategy that we can use to really change health here in Guernsey comes from and is attributed to Thich Nhat Hanh. And he says, "Community is the guru of the future." I trust that Guernsey will be a 65,000 person petri dish for the future of medicine, a community that empowers each of us to be healthy and reduce chronic disease, because it's community and not medicine that creates health. Thank you.